Nailed her.
Okay, now can we stop that?
Oh dear. Let's see, Aria. Matters in the Arctic region right now. Welcome to the fourth episode of the Arctic Resilience Forum 2020, hosted by the Icelandic Chairmanship of the Arctic Council and organized by the Sustainable Development Working Group of the Arctic Council and our Arctic Initiative here at the Harvard Kennedy School. My name's Joel Clement, and this week's episode is focused on human health and pandemics, which is obviously one of the most pressing and top of mind risk and resilience matters in the Arctic region right now. This week's session has also been included as a plenary session in the SDWG meeting. So welcome also to the many Arctic Council delegations from the 8 Arctic states, permanent participants and observers. A couple notes of housekeeping. Note that at the bottom of your screen to the right is an interpretation button. Thanks to the generosity of the Arctic Council, we have the capacity for you to hear this in English or Russian. So click on your preferred language there. And you'll understand everyone speaking today. Also, you received a registration for a Slack channel when you got the registration for this session, and feel free to use that Slack channel to continue the conversations before, during, and after the session today. And then, yeah, Brittany has just put a link up to the Slack channel in the chat section here. So before we begin, I just want to say, as we get deeper and deeper into this 10-week series with sessions already on Indigenous youth, food security, and energy, it's exposing the many interactions among these elements of life in the Arctic. Not one of these issue areas is operating in a silo. They're all very intricately linked. And they share many of the same enabling conditions, and that's something that Indigenous knowledge holders know best of all. So the resilience frame is allowing us to explore these interactions among elements just as much as the elements themselves. And this opens a door to greater cross-boundary intersectional work, which is so essential during a time of transformation. So again, Indigenous knowledge holders already know how to do this. So in some ways, Western knowledge systems are just catching up. And of course, a pandemic is a classic example of what resilience people call a shock. So we're seeing the principles of adaptive capacity play out before our eyes, and we're seeing areas of remarkable resilience and other areas where we have learning to do. So I hope you enjoy today's session. And we're going to get started with some remarks from a special guest star, Stefan Skaldarsson, who is the chair of the Sustainable Development Working Group. So over to you, Stefan.
Thank you. Thank you very much. Dear colleagues, dear listeners out there, on behalf of the Sustainable Development Working Group of the Arctic Council, I would like to thank you all for joining us. The SDWG is pleased to co-organize the second Arctic Resilience Forum together with our colleagues at Harvard Kennedy School's Arctic Initiative. The level of participation in these sessions we have hosted so far, the level of participation in the sessions we have hosted so far has exceeded our expectations and reinforced our belief in the importance of continuing the discussions about Arctic resilience. This forum has provided a platform to discuss topics that are important to Arctic communities and draw connections between these topics under the umbrella of advancing Arctic resilience. While all the topics being discussed as part of the forum are important, the issue of human health and pandemics is certainly top of mind for all of us right now. How the Arctic Council can play a leadership role in understanding and responding to the COVID-19 in the Arctic is something that the SDWG has dedicated particular attention to over the last 7 months. For this reason, we decided to incorporate this particular Arctic Resilience Forum session into the STWG meeting that is currently taking place. Over 100 delegates from Arctic states, permanent participants, observer states, and organizations are joining us today for this event through the STWG meeting. The discussions that will take place today and in all other Arctic Resilience Forum sessions will be available food for thought as the STWG continues its work. In fact, the results of this year's Arctic Resilience Forum sessions will be presented to the members of the Sustainable Development Working Group at our meeting in February 2021. We will also provide a summary report to the senior Arctic officials of the Arctic Council and our colleagues at other working groups at the Arctic Council. On a final note, let me thank the Harvard Kennedy School's Arctic Initiative for organizing this forum in cooperation with the Icelandic Arctic Council Chairmanship and co-organized with the Arctic Council Sustainable Working Group. Furthermore, to personally thank the many experts and knowledge holders that have been involved in the organizing of this year's Arctic Resilience Forum and contributed to it with their expertise. I look very much forward to the fruitful discussions. And now I'm pleased to hand this event over to today's moderator, Embla Oddsdóttir. Embla is the director of the Icelandic Arctic Cooperation Network. She is current chair of the SECEC, the Social, Economic and Cultural Expert Group of the STWG, and lead of the Arctic Council Chairmanship Project, Gender Equality in the Arctic 3. Embla, please.
Embla, you're muted.
Thank you, Stefan, and thank you, Joel, and thank you for inviting me to be a part of this event. Hello to all of you. Good morning, afternoon, or evening. Thank you for being with us here today. We're happy that you're participating, and you're very welcome. It looks like we have a very good turnout today, and we think we can promise you an interesting and engaging session. My name is Embla, and I will be your moderator for this Arctic Resilience Forum session on health and pandemics. Just to let you know how the forum will roll, it is broadly divided into 4 parts. In part 1, we will begin with contributions from 2 speakers. Although in the interest of time, we will not be taking questions for our speakers. We have with us today an excellent panel that we can ask questions of and have a dialogue with. In part 2, when speakers have finished their presentation, we will play a brief video, approximately 5 minutes, followed by a 20-minute Q&A. We ask that you use the chat function to pose your questions, and we will try to get to all of them, if at all possible. In part 3, we will repeat the exercise from part 2, starting with a brief video followed by 20 minutes of Q&A. And in part 4, we will play for you a final short video followed by closing remarks by Joel Clement. If we now, without delaying any further, turn to our speakers, I want to introduce our first speaker, which is Jennifer Spence. She is the Executive Secretary of the Arctic Council's Sustainable Development Working Group. She has a PhD in public policy with an interest in Arctic and international governance, institutional effectiveness, and innovative policy. Jennifer will now provide us with an overview of the Arctic Council work related to COVID-19 pandemic. Go ahead, Jennifer.
Wonderful. Thanks so much, Embla. I really appreciate it. I have the pleasure of speaking with you today. As Joel talked about when he opened, what we know is that the COVID-19 pandemic really represents the type of shock that we're talking about when we discuss the need to support resilience in the Arctic. It's ultimately a real-time stress test, and it provides valuable insight about what Arctic resilience might look like or does look like. So the question is, how are we actually doing? Andrei Petrov is going to talk to us specifically about some of the actual data around the presence of the virus in the Arctic. And we're going to hear from some fabulous speakers in our panel about from a local experience and perspective. From a policy and public governance geek perspective, which is mine, I'm going to talk a bit about some of the circumpolar institutions and how they've responded to COVID-19 so far. So in the spring of this year, when the WHO, or the World Health Organization, confirmed that COVID-19 had become a global pandemic, a core group of people were asked by the Senior Arctic Official Chair to coordinate the preparation of a briefing document for Senior Arctic officials to inform a discussion in June about what the potential role of the Arctic Council might be in responding to COVID-19 in the Arctic. The Arctic Council has an amazing network of experts and knowledge holders that it can really leverage. And we were able to connect with over 50 people from all over the region to contribute to a briefing document that provided senior Arctic officials with a comprehensive analysis in just 5 weeks. The report itself, which is now publicly available, was well received by senior Arctic officials. And as a next step and a tasking following that, we were asked, Arctic states, permanent participants, and the Arctic Council subsidiary bodies were all asked to respond to the advice provided in that briefing document and propose specific ideas for what the Arctic Council could, how the Arctic Council could respond. Since that time, the Sustainable Development Working Group has worked again with the same network of experts and knowledge holders to prepare its advice for senior Arctic officials. And we're looking forward to this advice being discussed as a topic at the next SAO meeting in a few weeks. So the question becomes, how are we doing? Well, I would argue that so far what we've seen is that the Arctic Council and the institutions across the circumpolar region have demonstrated a flexibility to respond to the issues that are current and unexpected. So I think that that is something that's really critical in this context. I think the Arctic Council has also demonstrated an ability to mobilize and bring together those expertise in a timely way and really leverage the capacity that exists in the Arctic. I think that there's also a need, and what has been demonstrated is the ability to collaborate and to connect the dots between many different initiatives. Because the reality is that in a shock situation like this, many organizations will mobilize, and the question is, how do we work collectively to really tackle the issues that we face, as opposed to working independently and perhaps overlapping? And so we've started that process, and I hope that that can continue. And the final piece is, I think one of the things that's perhaps most interesting is the broad lens that we've taken to the issue of the impact of the pandemic. We can look at human health, but really we have to go beyond that. We have to look at the interconnections and the multidisciplinarity of this, in the way that we involve experts from many different fields, in the way that we have looked at issues and how we sort of understand the impacts of the pandemic in the Arctic, and also this very session and the other sessions around it, which are all interconnected. When you look at Arctic resilience, we know that we have to make those connections between the different issues, whether it be infrastructure, connectivity, human health, mental health. We talked about food security. And so it's really important to continue to keep a really broad lens and understand the impacts of the pandemic. But where do we go from here? So the question is, can we continue this momentum? Can we continue to collaborate and connect the dots? I think that that the Arctic Council and all of the Arctic institutions have demonstrated that they can work together, and that even more of that is needed moving forward. I think, and as we'll show in this session, that we've seen that there are opportunities to recognize and share the experiences of the strengths and resilience that exist in the Arctic, and that we really need to capture those and really hear those stories and share them across the region. And we need to recognize that this pandemic has also demonstrated particular risks and vulnerabilities in the Arctic, and we have to be sensitive to those, and we have to use that understanding to mobilize the energy and the effort that will be coming both as the pandemic continues and after the pandemic to really tackle some of the underlying vulnerabilities that have really come to the fore in this context. So I hope that we will all have an opportunity to continue to work together in this context, and I look forward to the continuing discussion.
Thank you so very much, Jennifer, for this excellent presentation. You took 5 minutes to the second. Well done. I also want to ask you to accept congratulations and gratitude for your spearheading this important work. By the looks of things today, there is more work coming your way in this regard. Our second speaker is Andrei Petrov, who is an associate professor of geography, the director of the Arctic Center and academic director of the Geo-Tree Center at the University of Iowa. Andrei leads the Tracking the Spatiotemporal Dynamics of the COVID-19 Pandemic in the Arctic, or COVIDA project. He is going to provide us with an overview of COVID-19 cases in the Arctic.
Thank you, Embla. And it's my pleasure to be here, and I guess my responsibility to share some of the data points regarding COVID-19 in the Arctic. So without further delay, I'll just go ahead and share my screen, and hopefully it all works. So I am, as Embla said, I'm leading a project that looking into understanding and tracking COVID-19 pandemic in the Arctic with my colleagues, mostly at the University of Northern Iowa Arctic Center, and some of my other colleagues. It's a project supported by National Science Foundation. So if we just go right now to the COVID-19 Arctic data tracker, we'll see that today we have over 170,000 cases detected from the beginning of pandemic to Monday in the Arctic and northern regions of the world. And we also had over 2,200 deaths associated with this pandemic. So it's really an ongoing and very prevalent event that actually spread across the entire Arctic region. If you look at the map here, you see that all regions are engaged with the pandemic. Some regions have it worse, some regions have it better, but it's really all prevalent all across the Arctic. From the very outset, I should say that collecting this information, that's what we do on a daily basis, is a challenging task because there's a lot of data limitations, a lot of inconsistencies in the reporting across the jurisdictions, but we do our best with best available data. Again, if you look at this map today, you see that a lot of Russian regions and Alaskan regions are actually leading the way in cases per capita, and also in fatalities. But again, the pandemic is dynamic. It's kind of spread across the entire region, and it's really important for us to work together to understand what is happening. I don't think I need to remind this audience that Arctic communities, of course, have very special characteristics that make the pandemic even more severe, or could make it even more severe there, including limited healthcare facilities and other infrastructure. Of course, the high prevalence of various comorbidities, such as hypertension, diabetes, heart disease, tuberculosis that we find in many communities. There is, of course, the history of pandemics in the Arctic, especially the Spanish flu, that memory still lives in many places. And at the same time, and Jennifer kind of pointed out, I'm sure our panelists will talk today, there is a lot of resilience that's embedded in the community, especially Indigenous communities, while Indigenous peoples have been able to leverage traditional knowledge in the past to confront pandemics in history. So there is a hope that we could work together with science knowledge and Indigenous knowledge to fight this pandemic as well. Let's dive in a little bit into the data. So as you can see, here is the graph of the cases, confirmed cases in the Arctic from February 21st, when we found a first case in the Arctic, all the way to Monday. As you can see, it's been progressing very rapidly, from 8,000 in May to 170,000 2 days ago. We can also see that there have been two distinct waves, and we are actually right now living in a upper trend in the second wave of the pandemic. And that's, of course, gives us a lot of perspective that, pandemic is there and it will last for a while. And there's no really relief so far. This said, we could say that in the Arctic regions of the Arctic states, the pandemic has been still less severe than in the southern parts, although it is worsening. We do see that, the key indicators such as cases per 100,000, deaths per 100,000, and case fatality ratio are still lower in northern parts of the Arctic states compared to the southern. And that's probably related to diffusion of the disease, of the pandemic. So actually, it doesn't mean that it will remain so. We also see stark regional differences. If you look at this graph that shows us cumulative cases per 100,000, we see that early in the pandemic, countries like Iceland, Faroe Islands had been affected rapidly and exhibited high rates, and then sort of leveled off, while other jurisdictions, including northern Russia, including Alaska, sort of increased. And this second wave, we see that they are leading the way in terms of cases detected. We can also see same pattern or similar pattern in terms of the fatalities. We actually can see Sweden was quite different from many northern regions, or northern regions of Sweden were different from other Arctic and northern regions with fairly high fatalities early in the pandemic. But now, of course, it's a little bit different, while we see increasing rates in other jurisdictions, such as Alaska and northern Russia. The good news is that case fatality ratios are declining, and they're still high, but they are declining. And then the second wave, as we're experiencing now, they are actually not going up. There are a variety of explanations for that, both related to testing, the prevalence of testing, and with demographics of people getting sick. But still, that's not a sign of relief. It's still a very high case fatality rate. So basically, how many people who are getting sick are actually passing away. If we just put it all together and look at the daily cases and deaths, you could see that Arctic regions kind of pursue different paths related to their location, related to their policies they implemented, related to the characteristics of their healthcare systems, and various other reasons. So really, we kind of see four different patterns which Arctic regions follow. Number one is the kind of shockwave pattern, which is Iceland, northern Norway, northern Finland, Faroe Islands, that had spikes and dips and almost didn't have much cases, right, throughout summer, but now are in the second wave. We have a prolonged first wave, which is we observe in northern Sweden. That is, of course, in many ways related to overall Swedish response to the pandemic. The tidal wave, when we have cases going up and up with very unsubstantial dips in summer, that would be Russia and Alaska. And finally, isolated splashes is those jurisdictions, Greenland, northern Canada, that really had a few cases here and there, but didn't really have caught on the full-blown pandemic yet. So what does it all mean? Well, we just starting the second wave in the Arctic, and many more may follow. We see that there's a diffusion of the pandemic in more remote areas from less remote areas, and that's, of course, concerning for Arctic communities. We see the elevated threat to Indigenous communities, and especially difficult to interpret and understand because there's a lack of systematic data in this regard. But we know that pandemic disproportionately affects elders, key knowledge holders, and that, of course, may impact wisdom, culture, heritage, and tradition in Indigenous communities. We are concerned with the hotspots centered on extractive industries that may and have spread to neighboring communities. We also understand that negative effects of COVID will likely be lasting for a long time and exacerbate already tenuous economic and social conditions while generating immediate and future costs based on both in healthcare and in other systems. I mean, the bottom line is, and I really do hope that our panelists today attest to that, is that science and Indigenous knowledge must work together to develop knowledge-based policies addressing COVID-19 that are based on all knowledge systems working together, both short-term and long term. So with this, just if you're interested in tracking COVID-19 in the Arctic, please go to our website, arcticcoviduni.edu, and you will have access to various materials, including some interesting materials for your communities regarding pandemic rules and other things. But thank you very much. Again, I would like to acknowledge NSF for sponsoring this, and for my my colleagues. And Embla, thank you very much for giving me the floor.
Thank you, Andre. Thank you for this very informative presentation. It did have some emerging challenges obviously lie ahead, significant challenges, reminding us that it is not yet time to relax, and we need to continue to be vigilant, and that it's necessary for us to continue to monitor the situation into the future. I want to start with part 2 now, which is a panel on strength and resilience of Arctic communities. The way we will do this is to start with a short video compilation comprising of snapshots from interviews taken across the Arctic, focusing on strength and resilience, ways of learning, coping, supporting, and finding solutions together. The emphasis being on community approaches in responding to the COVID-19 pandemic. These are highlights from field videos that members of the session organizing committee created and shared with us. We truly appreciate their efforts, and we want to give a special nod to Ben Craig from the Harvard Belfer Center. Thank you for your time and effort during this process. I will quickly introduce the panelists. I will not give their full bios. You can find them online. But please note that the panelists, we will have the same panelists for both sessions. I will ask the panelists to please turn on their cameras and maybe give the audience a little bit of a wave when I introduce you. So if I start with Arja Rautio. Thank you, Arja. Arja is the VP of Research at the University of the Arctic, Professor in Arctic Research at the Tuli Institute and Faculty of Medicine at the University of Oulu in Finland. Arja is a national key expert in the human health groups of the Arctic Council working groups AMAP and STWG. Welcome, Arja.
Thank you.
Christina Henriksen, are you there?
I'm here.
Thank you, Christina, and welcome. She is the president of the Sami Council and is from, and I apologize for my pronunciation, but I'm going to try, Kirkonjarka or Kirkenes, which is where the Norwegian side of Sapmi borders, both Finland and the Russian Federation. Christina represents the Norwegian Sami Association in the council and served as a member of the Sami parliament on the Norwegian side. Next, we have Gary Ferguson. There you are. Good to see you, Gary. He serves as a faculty and director of outreach and engagement at Washington State University Institute for Research and Education to advance community health. It's a very long, that's a very long description. At Washington State University for Research and Education to Advance Community Health, located in the Elson S. Floyd College of Medicine. He's a member of the STW Arctic Human Health Expert Group, AHEC, on behalf of the Aleut International Association. Welcome, Gary.
Good morning.
We then have Gert Mulveit, who's with the Greenlandic Center for Health Research, the University of Greenland, and a member of the Greenlandic Research Council. Gert is the chair of the Greenland Institute of Natural Resources, as well as being a family physician at the Center for Primary Healthcare in Nuuk. Welcome, Gert.
Thank you.
We have also with us Grigory Letkov, who is the president of RIPON. And there I see Grigory. RIPON is the Russian Association of the Indigenous Peoples of the North. Grigory is Nenets. He's born in Naryan Mar. My apologies to you, Grigory, as well for my pronunciation. Naryan Mar is in Nenets Autonomous Region. He's a member of the Federation Council from September 2020, the upper house of the Russian Parliament. Prior to that, he served as a member of the State Duma and as a deputy chairman of its Committee on Nationalities. Welcome, Grigory. Finally, we have Stuart Harris. who is the founder and chief of Massachusetts General Hospital Division of Wilderness Medicine and the director of MGH Wilderness Medicine Fellowship. He's a full-time attending physician in the MGH Emergency Department and an associate professor of emergency medicines at Harvard Medical School. Welcome, Stuart.
Hello all, thank you.
I bid you all welcome and thank you for being with us here today. We will now commence the questions and answers session with our panelists. I can see that questions have started to come in. I will start with a question probably to Stuart. And it goes
with a video.
The video. Can I ask the panelists to please stay on video?
The video we need to play.
We need to play the video. I'm sorry.
We have seen recently with this COVID-19 pandemic that family is core into how we adjust and how we deal with a crisis happening.
Small community, very personal, and how that was leveraged. It was leveraged by phone calls to people's homes, cell calls. Who do you know that can guide me through? Who do you know who can help me through this particular challenge?
My people, I'm talking about my people, the Inuit here more specifically, wants to hear a professional speak about what they know, but they also want to hear it in their language.
We have materials and information that is provided in, I think, about 20 different languages. So we have taken great care to work with the different linguistic communities that we have in our city to ensure they have access to just information, first of all, but secondly, to be able to get the resources that the city is making available.
There are some very old traditional methods and then some more modern methods. And the two most effective, I think, that we found were getting a unified message on the Manilek Facebook page.
Many of the information that had to go out also went on social media.
And then for people that don't have access, the community health aides are such an amazing resource and use the VHF radio.
The best way was to communicate through local FM stations. And on a regular basis, I went on the regional radio along with members of my Inuit staff. Each mayor went on their local radio to inform their people of the status of the situation.
The dedicated, tight-knit group of providers and their close relationship with community health aides and community leaders was immediately apparent. This is definitely a great asset to the community for everyone to express their fears.
I didn't really need to be so worried and stressed because the more I spoke about this, the more support that I actually felt in my community, and I still feel support around me, which I think is very important, and people should absolutely not feel ashamed. We're all working together in trying to prevent the spread.
Our organization, the Regional Health Board, made sure that we had 1-800 numbers available in COVID info line for people to call up regarding their fears, regarding their questions, their anxieties. This was more like to help people deal with the psychosocial aspect of dealing with the virus and the pandemic.
And here in Alaska, we've been very fortunate that we have a very assertive public health leadership team, and we have widespread testing and a very active contact tracing program. We've really ramped up our usual contact tracing efforts. What is a case? Who is a contact? What does isolation mean? And what does quarantine mean? So that our contact tracers can give the most current and accurate advice to the people that we contact.
Indigenous knowledge of subsistence living was going to become vital when many supply chains were going to become disrupted. So one of the most beautiful responses that I saw was one of the communities Their group of younger folks on the search and rescue team went out and did a caribou hunt and were able to hunt 17 caribou and deliver them to all of the elders in their village in order to make sure that there was additional subsistence for a time when, orders of dry goods from Amazon or wherever else were unlikely to arrive in any expedient fashion.
Families were out on the land. Communities were out on the land, despite that, we had to follow guidelines of distancing, but different families went out to the land and enjoyed what they can. And this was a way of escaping the conditions we were put under. The land is our place, and what the land gives us heals us.
The role of the Arctic Council, the role of IASC, all these international organizations that maybe we take for granted or show up at meetings, that do really good work, but how much they were referenced over and over and over again, not just for the personal networks, but for the work that they do. It's part of the DNA now of the network that has a role. And we learned, I guess, a lot about the programs and the organizations that we do have value in a very different way during a pandemic.
Hi again. And thank you for sharing the video. We have some questions that have already started to come in, and I want to start on hopefully a fairly positive note with a question that I want to direct to maybe Stuart. I wonder if Stuart would be able to take this one. In the immediate term, the pandemic has been a tremendous stress on individuals and our systems. How has the pandemic advanced important long-term health or social goals in your area? Stuart.
I'm sorry, I don't know if it's on my end or your end, but I heard the very first and the very end of the question, but not the interval.
Oh, well, that's not good. Shall we try again?
Lovely, thank you.
In the immediate term, the pandemic has been a tremendous stress on individuals and our systems. How has the pandemic advanced important long-term health, social goals in your area?
I think taking away both from the videos from physicians and care workers I've talked to, primarily in Alaska, but in other Arctic regions, just how the stress test of the pandemic has had a remarkable, I think in some ways it's sped up a lot of things. So things that we had thought were absolutely structured, unmovable, immutable systems, whether it was travel or the economy or how our health system interacted in the interplay of the out of doors and the indoors. It's really, I think it's forced us to look at things very differently. And I think in some ways, I would love to think that we're going to come out of the COVID experience having learned a great deal about how quickly the world can change. And sometimes that's may make us feel uncomfortable, as in the COVID response. But in other ways, I think it's been an extraordinary opportunity for people throughout the Arctic and for people across the globe to really look at why are we doing what we're doing, and if we're not doing it well, and if we're doing it in a way that's maybe impacting future generations, things might change a whole lot more quickly than we might have allowed ourselves to believe a year ago. So I would welcome any insights from the rest of the experts in this extraordinary community along those lines.
Thank you, Stuart. Maybe if one other person could chime in on this, but I don't necessarily think we have the time for all panelists to respond to all questions. But does anyone else want to chime in on this particular one? Arya, do you have a?
So that about the question what is the impact in the future and how long-term effects there are, it's really difficult to say. But I think that it's an issue that of course we are worried those chronic diseases if we don't go to the hospital and we are staying at home and afraid of the disease and infection. But I think that it also gives open eyes moment now to think that, because I think that this kind of situations, they can come also later on, not this pandemic, but something else. And that is also so that we need to just collect our forces to take the advantage, this collaboration and working together. And I think that it also gives us the possibility to understand each other more, so that we are at the same stage somehow, all the whole globe, so that it's not only one part, but it's the whole, so that we don't know what is the future. And that is surely very, very difficult to understand, because we have scheduled our timetables so much forward. But of course, the patients and people who are sick, that's really stressful situation. And I think that also the young people who have their youth, what is their future when they lose 2 years or 3 years in their young years when they should do and be with a group and with the others. I don't know if this was the answer of the question, but that kind of ideas, they were coming in my mind.
Yes, absolutely. Thank you. Thank you, Stuart, and thank you, Arya. I have a question from Tina Schoolmeister. She asks, what has the pandemic revealed in terms of ongoing inequities? And I wonder, Gary, do you want to take a crack at this one?
Sure. Kila Makamna, good morning. So, I mean, I think what we're seeing is a continuation of some of the things that we've known over the years as we look at health disparities in our communities and access to care, issues related to chronic disease, and of course, risk factors related to that. So, you know, we continue to see, and of course, we just had a report, the current statewide opioid action plan summit is this week, and there was a report by Dr. Ann Zink, who's just an amazing physician who's helping champion the COVID-19 response in Alaska. And you know, what's being reported is, you know, we are seeing some inequities related to hospitalization and death as well, related to it. So definitely continued repercussions of that overall disparity. And at the same time, I always like to focus on the bright spots. I would say communities are mobilizing, and I know we're going to have more time to talk about this topic, but I do feel like communities taking tribal sovereignty and cutting off traffic into our remote communities so that you can slow the spread. And so I feel like there's definitely there's two sides to that. I would say that we do see the inequities, and at the same time, I see this local ownership of folks stepping up saying, we will protect our community. We will show up and protect our elders, and all the scripting around that. So I would say that the inequities are definitely there. And at the same time, tribal leadership has stepped forward saying, you know, we see this and we're going to take action. So I think it's really helping to mobilize leadership in our rural, especially in our rural communities, but also in our urban population, to say, you know, we need to take ownership of this rather than always depending upon the outside.
Yeah. So in a way, these are quite positive developments, and thank you for focusing on the positive approach. I do want to ask, maybe Christina can tackle this one. How have you seen Indigenous knowledge being used to combat the pandemic? This is from Jeffrey McLean.
Well, thank you for the question, and in this particular matter, in this situation, the Indigenous knowledge and the access to traditional food has been a key, at least I can speak for the Sami communities, and that of course goes for those communities who have access to land. I saw there was also a question about just that, and also the food chain, if you're not having access to this, and the grocery stores. So our experience is that if the Sami communities have access to the land and to prepare to gather and to harvest and to get food from the land, they have been much better prepared than, let's say, if the food chain is cut off, if the import is down. On the other hand, of course, the Sami region is also not necessarily central, but we are closer maybe to the market than many other indigenous communities in the north. So, also I would like to stress that in order to provide and to use this traditional knowledge, to find this food that we need to be able to sustain ourselves on the traditional food, we need access to food, and that means we need clean waters, and we need the land and a healthy ecosystem to be able to do that. So that is one of the core things we have experienced in the COVID-19 situation. Thank you.
Embla, your mic.
I'm really still getting the hang of this new format of online meetings. I wonder if a couple of more of you could share with us some positive stories that have emerged as a learning from the impact of COVID-19. Maybe Grigori or Gert, or both of you, could quickly share with us some beneficial impacts.
Maybe I.
Хорошо, спасибо.
Okay.
Grigori, you go ahead.
Хорошо, спасибо. А то я, может быть, коллегу перебил, ничего. Меня хорошо слышно, да? Да, хорошо. Добрый день, уважаемые друзья. Вот, ну, очень интересно послушать информацию, как вот в Арктике ситуация, вот, и как она по различным странам у нас складывается. И вот все выступления, пожелания, мнения наших жителей Арктики, коренных народов тоже. Но мы в России, территория арктические очень протяженные. Вот, и если брать нашу общероссийскую ассоциацию, вот, наверное, половина из всех коренных народов, малочисленно проживающих в России, то половина из них это арктические регионы, арктические народы, вот, которые живут от Мурманска до Чукотки. Вот. Ну, понятное дело, что мы так же, как во всех странах, мы смотрим новости и видим очень хорошо вот, информацию с телевизора, в интернете новости. Они доступны, и, конечно, больше-то мы видим общую картину, что происходит в разных странах и что происходит у нас в России по срезам, вообще по всем регионам нашим российским, не только арктическим. Вот, ну, именно по арктическим регионам, конечно, отдельной статистики нету, потому что у нас много территорий. Вот, и, конечно, в первую очередь большие очаги – это ситуация крупные города, где крупные массы, много людей перемещаются, ездят. И, конечно, мы тоже, как весь мир, с напряжением смотрим, интересуемся, переживаем за знакомых, за родственников. Вот. И вот такая ситуация многому нас чему учит. Вот. И меры, которые принимались вот в период первой волны, тоже население, мы все вместе их переживали. Для нас это было очень новое, когда самоизоляция. Для России очень менталитет народа, людей очень общительные, сильные родственные связи. И, конечно, привычка ходить на работу, общаться, на учебу ездить, отдыхать в летний период, конечно, нас заставляет всех пересмотреть вообще свою жизнь. Вот, и мы видим, как мы сходу начинаем учиться новым приемам, и я сам вот стал лучше разбираться во всяких гаджетах, и есть некоторые пользы. Плюс в этом оказывается, что раньше надо было собираться в командировку и, например, ехать на какую-то встречу, то если это Хабаровск или Сахалин, это надо лететь 9 часов. Это как до Пекина или как до Нью-Йорка из Москвы. Вот. И, например, в Финляндии гораздо быстрее можно доехать до Хельсинки, чем до территории наших восточных. А сейчас мы научились, видите, и я вот уже который день работаю, не отходя вот, и сразу параллельно несколько встреч вот, способом телекоммуникаций. Вот, и оказывается, это экономит очень сильно время, очень сильно экономит время, финансы, снижает риски вот в настоящей ситуации. А при хорошем подходе и организации мы видим, что насколько это тоже эффективно. Потому что принятие решений общественной большой нашей организации, это происходит быстро. Взаимодействие с каким-то министерством или ведомством, или с каким-то субъектом, компанией, то же самое, мы очень быстро эти коммуникации наводим, и сразу же идут какие-то письма, обращения, реакции. Получается так, что наоборот, жизнь ускоряется. Поэтому это тоже надо учитывать. И, конечно, для наших северных территорий тем более это актуально, потому что покрытие средств связи и интернета еще не везде сильно. Значит, и мы видим, что государство на это реагирует, что органы власти учатся также работать по удаленной системе. Вот, и мы надеемся, что в ближайшее же время вот это сыграет плюсом для того, чтобы государство обратило, и все компании, крупные промышленники обратили на это внимание, и оно, может быть, быстрее пойдет в наших отдаленных территориях, это развитие интернета и вот таких коммуникаций. Вот. Ну и в плане противодействия вот этим рискам, болеть или лечиться. Я вот, кстати, сам, я только вышел с больничного. Вот, я почти месяц лечился дома, вот, нахожусь на работе в Москве, семья у меня на севере. Вот, я тут один лечился, в больницу не попал, но вот сейчас выписался, вроде бы так, без видимых каких-то потерь, все вроде бы нормально. Вот, но я хочу сказать даже на себе, сразу же родственники, старшие члены семьи, они сразу же достают рецепты народные, и есть запасы всегда в холодильнике народной медицины нашей, какие-то там виды ягод, виды бульонов, мед, орехи. И мы постоянно же, у нас есть встречи среди коренных народов, и, конечно, смотришь сейчас вот на запас вот этих лекарственных трав, всевозможных продуктов питания, которые приносят пользу человеку, укрепляют иммунитет. И, ну, не знаю, ну, достаточно быстро вот так вот, без каких-то серьезных последствий, вот, организм лучше становится, на себе проходишь. И, конечно, мы между собой разговаривая, мы тоже об этом замечаем, говорим, что да, значит, надо еще большей тщательностью смотреть на ту народную медицину, побольше общаться со старшими, смотреть литературу и, конечно, те продукты питания, которые испокон веков у нас были, вот, они хорошо поддерживают организм. Вот, и они, самое главное, что они для нашего организма лучше приспособлены в его усваивании, и тем более, что оно доступно нам. Вот, и нам даже, например, если мы заготавливаем какие-то дикороссы летом или какие-то виды биоресурсов, перерабатываем для цели лекарства, то нам даже и покупать их не надо. Мы их добываем, мы их собираем, и это надо помнить, этому надо учиться. Вот, ну, в общем, ситуация такая, вот, и, конечно, надо сказать в том числе, что в тех местах, где удаленно живут коренные народы в Арктике,
Well, thank you, Gregory,
вот, это и риски,
for sharing this
вот,
with us.
и в этом же и польза есть, потому что если до туда не дошло, то туда и не дойдет, потому что один рейс там раз в неделю вертолет, или сейчас пока снежный покров еще недостаточный, ледовая обстановка недостаточна, и снегоходами массово не могут передвигаться. Поэтому вот это спасает небольшие сообщества, где проживают наши коренные народы. Кочевники находятся на удалении. И я знаю, что у нас на севере ряд субъектов принимали специальные меры для предотвращения попадания вот этой инфекции для кочевого населения на фактории, для небольших поселков. Вот, проводили удаленные консультации, помогали с получением всех необходимых видов документов, социальной помощи, отоваривания продуктами, чтобы оно происходило вот, быстро и без массового скопления людей. Вот. И эти меры тоже они влияют. Но опять же мы видим, что
I'm sorry, Gregory, I can't hear you now. I don't think we can hear you now, but thank you. I think Gert, could you tackle this question very briefly, and then I have one final one for this panel that I want all of you to respond on with one word, basically. But Greg, could you take a minute or so? Thank you. Gert.
Okay, thank you. Just a short thing I want to put in here, seen from Greenland side. I'm a family health doctor working in Greenland for more than 30 years. And here we have had the problem with tuberculosis and measles. So we know the impact of these diseases on our village and remote area will have such a huge impact. So all the people know that it was important to lock down. And in Greenland, we are independent and we have the health authority here in Greenland. So when the people say we have to lock down because it's important for all of us we cannot handle this COVID situation in the very remote area. And then we lock down. And we have reopened, but we have a very good restriction for people coming in. And today we in Greenland only see 16 and 17 cases of COVID-19, and all have been isolated, and only one still is not recovered. Anybody is dead. And that means that here in every village, we can live without the COVID. We know it is possible that it can come into our area, but we rely on the government, and the restriction will work. So it will come in a way where we can handle it and still in a way live as we used to live together. And as a population in our area to live without COVID in a way, but knowing that we have to do something if it come in. It is a way to live where we live and look at the situation, how hard it is in other area to live with its diseases. But here we are free of it, and this means something for people, but of course the restriction have a lot of other possibility which we have to handle and have to deal with. But when we know that it's our own government who have locked down on behalf of the population, we are prepared to take care of the situation and all the reaction which will come to the lockdown.
Okay, thank you, Gert. I'm being told that we have in fact run out of time for this session. So what I want to do now is end this session, and we will be playing another video. There's a couple of questions that we didn't get to, and I will move them to our next session so we can cheat a little bit and still take them. So if we can get the video now.
We have seen recently with this COVID-19 pandemic that family is core into how we adjust and how we deal with a crisis happening.
Small community.
Sorry, different video. One second.
Embla, you're muted.
It seems that we are having some technical issues with the video.
Every fissure became a gap. COVID amplified everything.
One of the main long-standing issues have been the issue of housing. Lack of housing is everywhere. Lack of housing causes overcrowding. And if we have 10 people living in a 3-bedroom, how are we going to deal with that family if one of them gets infected with the virus?
How do communities socially distance? How do they do that when they're in small communities, limited availability of housing? And how do you socially distance 3 families in one housing unit in a very small community?
Those who may already be marginalized or live in multi-generational households with few supports often are seeing the biggest disproportionate share of this.
Although we are remote, we are very close to a major city like Montreal, in which we found that some of our people traveling from there had contracted the virus, and we had to deal with that.
But many families, they are divided by the border. So let's say there was one father who lives here in the village, and his daughter was living just a few kilometers away, but they couldn't meet for many months because the border was closed.
Our ability to provide proper services is also challenged with the fact that we have very small, what we call the little health centers of each community that don't have a lot of space to work in. You know, we do need modern infrastructures in order to give better services.
Our limitations as a community to care for more than a couple of sick patients. You know, we only have 2 ventilators in the hospital. We have a limited number of providers with really expert knowledge in using those pieces of equipment.
А именно work свою, потому что, ну, здесь правда, и условия мало для лечения. Здесь, потому что до отсюда как бы лечение слабо доходит. Всех тяжело больных отсюда вывозят.
And having redundant, reliable, affordable internet just came up everywhere, whether it was from the research community or from educators who said, yeah, this is all great that we're hearing that we should go online, but do you know that it cost me over $500?
Теперь они стараются не контактить с людьми, боясь заразиться, потому что это осложнить прежде всего доставку самого врача туда, в тундру. И, во-первых, ограничение в лекарствах, особенно для него, который далеко находится от центра, и вовремя не смогут реагировать на это обеспечение опять вертолетами доставка, потому что дорог нет.
How do you wash your hands as often as the CDC says you can when you can barely get enough clean water in a community? Proper sanitation when you don't have indoor plumbing.
В отдаленных поселках, вот Нешка, Нурмина, там где-то еще, живут хорошие условия. Почему? Далеко не все хорошо кушают.
Alaska is highly dependent, especially in the summertime, on tourism. And because tourism basically stopped, we have a lot of local businesses who are really suffering as a result. We also have a big commercial fishing season, and we've had a series of outbreaks in canneries and fish processors. So it's impacted that as well.
We in the Arctic, not just the Inuit, deal heavily with mental health. We have high suicide rates, and this is during normal times. But in the context of the pandemic, it was aggravated with anxiety and fear of the unknown.
Психическая сторона, это, конечно, паника. Боялись, я помню, до первого время все боялись, что доходило до...
Confidentiality in a small town of 300 people is non-existent. With this day and age, with social media, just going out there, it's really hard to manage the issue of stigmatization.
I was actually very lucky not to give it to anybody that I know of, but it was a very stressful time. And I'm realizing with every month that passes that this is going to be a more long-term project for me. I'm of course hopeful to make a full recovery one day, but I'm also realizing that it's going to take some time.
Okay, thank you. Well, I can see that the video reflects what the report on COVID-19 produced by the Arctic Council reflected as well, which is challenges of infrastructure. I want to now go to a couple of questions that I think are quite interesting for the panelists. And again, I don't think we have time at all for all panelists to respond to all questions. There's an interesting question here from Lars Kullerud of the University of the UArctic. So what is the impact on reindeer herding families in terms of keeping knowledge or bringing knowledge to the next generation if this lasts for over 2 years? And I wonder, maybe Christina, would you like to respond to this one? Thank you.
Thank you for the question. Yes, that is a challenge in the Sami communities. One thing is that the border crossing reindeer husbandry has been affected by the travel restrictions and the different rules in the different nation states. But the restrictions on gathering and the social distancing is definitely affecting the reindeer herding communities. The reindeer herding communities are trying to protect the elders, not often the knowledge holders, by unfortunately not including them in the reindeer work, which is a necessary measure to take. That of course implies that the younger generation are deprived of this knowledge and this transfer of knowledge that is normally happening. So there is always this balance of taking care of the community and keeping people safe, and then also sacrificing in a way that very important part of it all. So one of the largest Sami reindeer herding communities in the Swedish side has just announced that they have very strict rules for this winter's work inside the corals, for instance. And also that goes for the neighboring communities, because the herds are mixing. So there are all these rules that need to apply now. So we are fearing what this might cause of consequences for the future if this just lingers on. Thank you.
Thank you, Christina. I have a question from Jan Dusik from the WWF. Now he wants this posed to all panelists, but I will only do that if you promise to only answer with one word. Please. So his question is, amidst constant flow of alarming news and ongoing need to handle the emergency, what would be the one positive long-term takeaway in terms of resilience and response of the Arctic communities? So if we can start, who wants to go first? Stuart, can you provide us with that one word, that one magical word?
I think sustainability, and I'll throw in a couple of quick words, but just the idea of food security as something that this isn't, you know, for your nice suburban lower 48 lifestyle, but just as far as Ashley Wiseman's story about the caribou hunt to provide for the elders, that's exactly what the Arctic, I think, can be teaching the rest of the world, and what I think we need to be paying attention to.
Thank you. Gary.
Thank you for the question. I would say returning to the power of our ancestors and the wisdom of our ancestors. And, you know, Stuart shared and has been shared already, the food system, the importance of it. When I was at the Alaska Native Tribal Health Consortium, the program from our elders, recommended by our elders, was the store outside your door. And the traditional medicines are Alaskan plants as food and medicine. So we're returning to our strengths, and I think that's positive.
Thank you, Gary. Gert.
I will just have a few words. Family, nature and food, and responsibility. Thank you.
Thank you. Arya?
I have taken care so that we can show our positive features in our human soul or human behavior.
Thank you, Arya. Christina?
I would say, of course, Indigenous knowledge, but also add community determination and care.
Good one. And finally, Grigory.
Ага, ну вот, разобрался с кнопкой. Вот. Ну, вы знаете, мы все равно смотрим на все эти события, что происходит в России, в других странах. И, конечно, в том числе мы все ждем, когда будут прорывы в области науки, медицинской науки, когда на самом деле будут... Мы надеемся на то, что в ближайшее время будут лекарства изобретены, опробованы, и, конечно, это позволит поставить точку на данной пандемии. Ну и кроме этого, конечно, надо сейчас смотреть на себя, на своих близких, защищать себя, применять все меры, и здесь в первую очередь, конечно, самосознание людей, средств массовой информации. Мы тоже в работе своей общественной организации тоже этому уделяем внимание. И, например, когда проводят какие-то мероприятия, крупные, межрегиональные или там, на федеральном уровне, мы отправляем письма от нашего координационного совета, от коренных, чтобы организаторы обращали внимание на безопасность, во-первых, согласовывали эти действия с соответствующими научными, медицинскими, государственными учреждениями и по возможности переносили эти мероприятия. Вот. И у нас есть примеры этому, что к нашему мнению прислушиваются. Есть случаи, когда переносят, отменяют вот такие массовые мероприятия. Мы сами тоже, вот, я же говорил о том, что мы пытаемся через интернет больше общаться и приостановили очень много мероприятий, которые планировали в течение всего 2020 года и конца 2019 года, и в начале 2021 года тоже будем смотреть и минимизировать вот такое прямое общение, чтобы поменьше передвигаться. Вот. И, конечно, вот соблюдение всех вот этих мер, работа научных государственных учреждений вот, должно к этому приводить. И, конечно, в том числе надо сигнализировать на местах, органов власти на местах, в наших регионах, чтобы тоже обращали внимание и по предотвращению, и по еще большему улучшению качества предоставления лечения, медицинских услуг вот в данной ситуации. Вот. Поэтому, ну, здесь, видите, мы, как сказать, вот всем миром должны налечь на эту ситуацию, потому что она касается не одного государства, не только одного. И здесь, чем больше благоприятная ситуация будем создавать каждый у себя в регионе, она в общей системе каким-то образом в итоге должна сложиться. Спасибо.
Thank you very much, Grigory. We have a couple of more minutes, or 4 to be exact. And I have a final question I think might help us end on a positive note. Experience of the interdisciplinary nature of problem solving in the Arctic provides a broad lens we might learn from. What are lessons from the Arctic experience that can be used to teach the rest of the world? And I wonder if we can start with perhaps Gary. Could you start with this one? And again, I'm going to have to ask you all to be brief.
So you know, as was mentioned so far, I mean, I do feel like we're remembering our strengths, the importance of our elders, the protection of our next generation, and just this knowledge transmission. And of course, with that comes a lot of fear, as was shared, but the flip side is we are taking action. And I think a quote from one of our elders, Dr. Rita Blumenstein, I'm gonna use as a way to message this. And she shares, we are free to be who we are, to create our own life out of our past and out of the present. We are our ancestors. When we heal ourselves, we also heal our ancestors, our grandmothers, our grandfathers, and our children. When we heal ourselves, we heal Mother Earth. She's a respected tribal doctor, elder originally from Tanunuk in Yupik. And I just feel like we are reclaiming some of the most important Indigenous wisdom around our foods as medicine, our culture as medicine. And I feel like this shock that we have in our Arctic communities is helping to steal what's important. Gathering together for meals, spending time with one another, you know, really truly valuing that human connection. And so I think those are some really powerful things that are coming out of this pandemic. Thank you.
Thank you. Christina, what do you think?
I would say self-determination and flexibility for the allowing the regions and the communities to take care of or to determine how to take care of their inhabitants, and also taking care of the ecosystems and have the opportunity to live from the land and use indigenous knowledge in the areas where that is natural. Thank you.
Arya.
So I think that we have a very good situation because we have the local and also the circumpolar Arctic. We have the different type of networks, and we have already used to work together. We have several levels of the actors. For example, in the Arctic Council and SDVG, we have the One Health program or project which has been going on, so that we have tried to more and more actively working together. So that I think that that is something which is not so much in other parts of the world, perhaps. But I think that the circumpolar world is and working together and networks, which has been also something very good advantage in the north. Thank you.
Okay. Stuart, would you like to quickly comment?
Yes, no, I've been tremendously heartened by, as Gary touched on and Christina, just the very human response to this. And I think kind of the body check of being knocked out of our normal routines. It's a horrifying, scary, and there's been a tremendous amount of loss. But I think what we're taking from this, what future generations are taking from this, is that awareness of things that are enduring, that are important, of an ecological view of health, that human health depends on a functioning environment. And that's universal. And I'm struck again by Minnie's comment when she said, families went out to the land is our place, the land heals us. I think that's something I've seen happening across the globe. And I think that awareness of what's going on around us locally in our families at the dinner table, but also of the entire biosphere, is something we should take great pride and pleasure in. And I think it's going to, in the long term, help us a great deal.
Thank you. I wonder if maybe we can switch gears a little bit, because I've been told that I actually have a few more minutes, so I want to make the most of them. It appears to me that most, if not all of you, have been involved with the work of the Arctic Council and its working groups. And I wonder if any of you would care to comment on how can the Arctic Council be of use in this context? And you can raise your hand if you want to answer the question. If you don't raise your hands, I will just pick and choose and put you on the spot. Who wants to go first? Gary?
Sure, just briefly, I would say the Arctic Council is an amazing forum for sharing best practices and bright spots. And I always like to share that, whatever we focus on grows. And I feel like we need to focus on community resilience, what communities are doing that's working, community assets, and culturally based responses that are moving the dial on prevention, on treatment, and improving resilience in our communities. And I feel like that's an amazing forum as we look at all of our Arctic communities coming together to say what's going well in our communities. What are we seeing? Like, for example, it was reported there's been an uptick in the suicide prevention care lines and a mental health crisis, and with new users. But the thing is, people are seeking help. We're seeing improvements in utilization of virtual platforms for counseling and therapies. These are things that we need to say, hey, this is something to celebrate and then grow. So sharing those bright spots is a really great opportunity for the Arctic Council. Thank you.
Thank you. Gert, you raised your hand.
Yes, for us living in the Arctic area, Arctic Council have a huge importance. What is important for us living in the Arctic is to tell the positive things and the learning things of living in the Arctic, which already have been said now, how to live in the nature, how to have food around your surrounding, and to sit together with your family and eat together with food which is gathered from during the summer times, and all that. The nature and the importance of nature to your health and your well-being and the way you are looking at the world. It's important for us to put that into the Arctic Council, and not only talking about military issue and other issues, which is taking over some of the discussion in the Arctic Council. We have to put the positive things for the people who are living in the Arctic and can learn rest of the world how to live in nature in a responsible way.
Well, thank you, Gert. Arya, do you wanna chime in quickly? I think now we're actually really running out of time. So
very quick. So thank you. So very quickly. So I think that we have this extreme important and nice instrument, this Arctic Council. And these 6 separate working groups, I think that I would be very happy that they would work in much more together so that they have more holistic issues and so that, as Kert mentioned, so that we could have this whole living environment, for example, in the human dimension, coming in a big picture and holistic way. So I really hope that these working groups could be working more together, multidisciplinary way. Thank you.
Okay. Now it is 16:55, and I'm told that I have to conclude. I wish we could continue this discussion. It is my understanding that we are using Slack, so if people want to continue a dialogue with the audience, then feel free to do so. It's been a great pleasure being with you all here today, and thank you for being a part of this. I want to give the floor to Joël Clement. First, we're going to hear a final video on hope, and then Joël will finish with his closing remarks. Good to see you all. Thank you.
We come from a long line of very, very adaptable and resilient people.
You should change the narrative. It should be thriving communities. How do we help these communities not just sustain themselves, but what is needed to make them thrive? Re-envision us, because we don't think of ourselves that way. So you shouldn't think that way.
I believe that both the Indigenous knowledge and the Western knowledge have a lot to gain from one another. They both have a lot to share. And in the event that the Western knowledge has to understand our realities and who we are and how we deal with things, as well on our side, we have to also understand what they have to teach us. So I think it's the most important part is to be able to share each other's knowledge and experiences.
We need partners at all levels of government, and between scientists and politicians and decision makers. We need people to come together around facts and understand what the impacts could be in order to hopefully curtail the worst of those impacts.
So I definitely encourage people to take it, to be very careful and to work together with the community to stop the spread, especially to protect the vulnerable individuals in the community.
It's really important that we as a people come together and support one another.
We have the world's eyes for a moment and ears. Now's the time to advance efforts that we have always thought were important.
Health,
family,
access, Indigenous knowledge,
the land,
network,
housing,
internet,
local businesses,
infrastructures,
clean water,
mental health,
communities,
communities.
Oh, my video is not starting. Well, unfortunately, my video is not starting, no matter how many times I press the button. But I will conclude with some comments, and you don't need to see my face for me to do that. Community, whether it's in the face of a pandemic, and maybe we can put up a slide, Brittany, while this happens. I'm not sure why that's going on. A transforming Arctic or long-standing mental health challenges, it comes down to the things we share in common, whether that be location, culture, history, or livelihoods. And the Arctic is rich with these common interests. As you've seen throughout this session, whether it be about communications, housing and infrastructure, self-determination, Indigenous knowledge, ecosystems, or mental health. These are all enabling conditions, either for risk or for resilience, that have been a common thread throughout all the issue areas we've addressed in the Resilience Forum. So addressing resilience means learning from the successes and failures discussed in the session today, seeking out the most effective and efficient way to improve those enabling conditions and envisioning a future in which the Arctic communities thrive and stay healthy through this climate transformation. So huge thanks to the speakers and the panelists, the organizing committee for this session, and the many voices we heard on the videos. Remember the Slack channel if you want to keep the conversation going, and note that we're not holding a session next week. but we'll resume again on November 11th with a session on broadband connectivity. And following that, we'll have sessions on gender, ecological resilience, financing resilience, infrastructure, and Indigenous knowledge systems. So we've had some amazing sessions, but there's still a lot more in store. For those of you participating in the SDWG meeting, you now have a 30-minute break, and then you'll reconvene back to the GoToMeeting platform using the link that you used yesterday. So thanks again, everybody, for joining. We'll see you on November 11th. And in the meantime, stay healthy and be resilient.